Hello everybody, my name is Chau. This is my adolescent physical examination. As an introduction, usually I'll be in the room. I'm gonna go wash my hands, wear some gloves on first. And quick introduction, this is Antoine Tran. He is 16 years old. So we're gonna evaluate him, okay? Hi Antoine, my name is Lynn. I'll be your specialist evaluating today. Can you tell me your name?
Antoine.
And how old are you?
16.
Good. And what grade are you in?
10.
Good. So prior to coming in, I would evaluate with parent by the bedside and evaluate on Antoine's birth history. So he is born term. Birth weight was 8.5 ounces and mom did not have any complications throughout pregnancy, and he was not in NICU after delivery, and no complications with his after delivery. So I have a few questions to ask you, okay? Do you have any medical history in the past? Anything that you've been diagnosed with?
No.
Do you have any surgical history? Have you had any surgeries in the past at all?
No.
Any trauma or injuries in the past?
No.
Are you currently taking any medication?
No.
Good. And I would also address with parents if he had any developmental delays. And for Anton, he did not have any developmental delays. I'll go through with parents regarding his developmental status according to his age. So with emotional and social changes, he's going to go through more conflict with parents at this age. He's going to show more independence from parents. He's going to have a deeper capacity for caring and sharing and for developing more intimacy relationship with the opposite sex. He's going to spend less time with his parents and more time with friends. As far as thinking and learning, he's going to show more concern regarding future schoolwork and also future plans. And he's able to give reasons for his choices, including what is right and what is wrong. Addressing back to Antoine, do you have any allergies to any medication or to any food that you know of?
No.
Do you know if you have any family, like your parents, do they have any history of high blood pressure, diabetes, any heart problems, high cholesterol?
No.
Or any history of like asthma or neurological disease like seizures or autoimmune disease that you know of?
No.
Good. And what school do you go to?
Edinburgh High School.
And what grade are you in?
10th.
Good. And where do you live? What city?
Edinburgh.
Good. And who do you live with?
My parents and grandparents.
Anybody else?
My brother.
Good. We're gonna focus on your diet. I'm gonna interview you, see how your diet is. Okay. How is your appetite?
Good.
Good. How often do you eat a day?
3 to 4.
Do you eat? What kind of food do you like to eat?
Meat.
Anything else? Do you eat a lot of fruit, vegetables?
Fruits and vegetables.
Do you eat snacks throughout the day?
Yes.
Are they healthy snacks?
No, not really.
No. What kind of snacks do you like?
Like chips.
Okay. Well, you need to incorporate more healthy snacks like fruits or vegetables like carrots, sticks, or like apples into your diet, okay? Do you drink milk?
Sometimes.
Or do you like to eat cheese or yogurt?
Yes.
Good. So if you don't drink that much milk, you have to incorporate like cheese and yogurt into your diet so that you have appropriate calcium so that your bones can grow, okay? Do you drink any caffeine or coffee or soda? No? Good. And how many cups of water do you drink a day, would you say?
Like 3 bottles.
Okay, so I recommend that you drink at least 6 to 8 cups of water a day to keep yourself hydrated, okay? And we're gonna focus on your oral hygiene. How often do you brush your teeth?
Twice a day.
Good. And are you seeing a dentist regularly?
Yes.
Okay, good. Do you have any cavities?
No.
Good. And next we're gonna focus on his eliminations. Do you go to the bathroom and have a bowel movement every day? Or every other day?
Yes.
Every day or every other?
Every other.
Every other day? And is it concerning to you? Are you having a hard time moving your bowels? Is it hard or diarrhea? Or any blood in your stool?
No.
Okay, good. And you're urinating well? No
Yes.
blood or in your urine or any frequency or anything that's troubling you with that?
Yes.
Yes? No?
I'm hearing well.
Okay. And cardio-wise, you get enough of physical activities each day?
Yes.
What do you do for cardio?
I run around the neighborhood.
Good. And how many times, throughout the day, how many hours do you spend on the video game, cell phone, or iPads? Would you say?
About 4 hours.
A day?
Yeah.
Oh, wow. Okay, so you have to make sure that you're not on your phones for so much. Every hour, 30 minutes, hour, you have to rest your eyes, okay? And do you know if you have a carbon dioxide at home or smoke detector at home for safety?
Yes.
Good. And anybody in the home smoke inside the house?
No.
Good. And do you know if there's any gun inside the house?
No.
Good. And do you wear a seatbelt in the car?
Yes.
Good. And are you involved in any risky behaviors like skateboarding or biking?
No.
Okay. But if you do bike or you do skateboard, make sure you wear a helmet to keep yourself protected, okay? And I have some private questions I need to ask Antoine, so I'll have the parents step outside of the room. And so I'm going to ask you a few private questions, okay? Are you involved in any recreation drugs like marijuana, weed, or vaping?
No.
Do you drink any alcohol?
No.
Are you sexually active?
No.
And then we'll assess for a depression screening. So you have a best friend at school?
Yes.
And what is his name?
Ethan.
Good. And then how are you doing with school? Are you
Very
having good grades?
Yes.
Okay. And what subject do you like? What's your favorite subject at school?
Math.
Good. And are you experiencing any bullying at school or anything that is uncomfortable for you to talk to the teacher about?
No.
Good. And you're making good grades?
Yes.
Good. So and then I'll have the parents step back inside. I'll ask parents if they have any concerns regarding Antoine's school or any complaints from the teachers in school. And according to Antoine's records, he's all up to date with all his immunizations. So we don't need any immunizations for today. It's also important to review the review system with parents. Sometimes when they're in the doctor's office, they might forget to address any of their concerns or complaints. So it's important to review the system. So it might, involve the parents and have the parents be more open to asking other questions. So I have a few questions. Just let me know with parents here if you have any regular or frequent headaches or dizziness.
No.
Any fainting or passing out in the past or recently?
No.
Or any eyes or vision problems?
No.
Do you wear glasses or contact lens?
No.
Good. Do you have any ears or nose or hearing problems?
No.
Do you have any throat problems or breathing problems like shortness of breath when you're running or playing sports?
Not really.
Good. Do you have any pain to your chest or palpitations?
No.
And any pain to your abdomen or throwing up or problems with moving your bowels?
No.
Any pain with urination? Any rash or moles or burn in your skin?
No.
How about any fatigue or muscle aches or joints?
No.
No? And then before we go through the physical exam, do you have any questions or concerns to address before we proceed to the physical exam?
No.
And I'll also address with parents to see if they have any concerns before we head to the physical exam. So if they don't, first with the physical, initially when the patient comes in, they'll have their vitals checked in, especially at this age. They should have their blood pressure, their temperature, the heart rate checked, and their height and weight. So we're gonna plot it and then show it to parents what his height and weight is, so they can see what his BMI and his percentile is. So Antoine is 5'9". He's 142 pounds. So with calculation, his BMI is 21. So with your BMI, you're at 56 percentile range. So you're in the middle range of the boys your age. So that's really good. So your BMI is healthy category for your age, okay? And his temperature is 98.0, which is normal. His heart rate is 70, which is normal for his age. Respiration is 20, and his blood pressure is 115/70, which is normal. Okay, so we'll go ahead and do your physical exam, okay? So I'm also gonna go wash my hands, put on my gloves, and examine Antoine. First, we're gonna go from head to toe. We're gonna examine his head. I'm gonna put my hand on your head, okay? So take a look at the scalp on his head for any dryness, any rash, any lesions, any bumps, which I'm not feeling any. Let me know if there's any pain, okay? And then upon inspecting his face, I do see some acne scars present. Any pain there?
No.
No pain or tenderness on the sinuses area or in the temporal. And open and close your mouth. Close. Good. TMJ is good. I don't hear any crepitus that I know of. And I'm going to palpate the eyebrows. It's soft. There's no swelling or any lesions or anything that I noted. Look up at me. His eyes are good. His scleras are clear. I don't see any drainage or bleeding. I'm going to have my pen light and check for the red reflex, which is present, and I also want to check on his capillary or his pupil reaction to light, which is good. I'm going to have you follow my pen to check for extraocular movement. And focus, which is intact. Good. And then check on his nose. His septum is midline. Plug one of your nose and breathe through the other side, okay? Good. And his nares are patent. I'm going to use my otoscope and take a look at his mucosa, which is pink. There's no drainage or there's no lesion. His septum is midline without any deviation. Next, I'm going to take a look at his lips, his mouth. There's no lesion noted. And then open your mouth and say ah. I'm going to have my tongue blade press on his tongue. His tonsils are intact. There's no exudate. Tonsil +1. Mucous membrane is moist. There's no lesion. And I don't see any cavities. All his teeth are intact. Next, I'm going to have my otoscope. Take a look at his ears. Palpate both sides of his ears. There's no lesions. There's no swelling. And I'm going to look at his tympanoid membrane, which is pearly. There's no bulging or any redness bilaterally. So I'm going to palpate on his lymph nodes. You let me know if there's any pain or tenderness, okay? And we want to feel one side at a time, just so that we prevent any vagal. We don't want him to vagal down. And short. Good. And I'm going to check on your strength. So push against my hand with your face. Good. Do the other side. Good. And shoulder against your shoulder against my hand. Good. And stick your tongue out, and I'll have a tongue blade to see to test his tongue strength. For the purpose of this exam, he's still clothed, but with my physical exam, I usually will have my adolescent be topless and just have his pants on. So first, I'm going to inspect his skin. Move this over. Inspect his skin for any lesions anteriorly and posteriorly. So skin is good, intact. AP diameter is within normal. I don't see any abnormality with his breathing. There's no retraction or intercostal breathing or with breathing. So next, I'm going to do his cardiac exam. First, I'm going to palpate his carotid, which is present. I'm going to auscultate for his carotid first with my bell for any bruise or thrill. Good. And then I'm going to also auscultate the 5 cardiac landmark with my bell, diaphragm and my bell. And normally I'll listen to his heart sounds for 1 full minute just to check on his apical pulse for a minute with time constraints. I'm not going to do that. Good. And the heart rate, there's S1, S2, there's no murmur or any clicking or any abnormality. Good. And then I'm going to listen to his lung sounds. I'll go in the back first. Turn towards me. But first, I want to percuss his lung sound, and this is without his shirt. Turn over. And percussion sounds good. It's normal. There's no any abnormality. And I'm going to take a quick listen to your lungs. Take a deep breath. Breathe in. Through your mouth. Breathe out. Good. Do it again. Breathe out. Good. Breathe in. Breathe out. Breathe in. Breathe out. Good. And I'm going to listen to the front. Breathe in. Breathe out. do this bell, so I'm gonna have you lie down, okay? Lie down for me. So first I'm gonna inspect his abdomen, make sure that it's not concave, it's flat, it's soft. So first I wanna auscultate his bowel sounds first before I start palpating. So I should be listening to his bowels for 1 full minute with each quadrant, but from time restraints, I'm not gonna do that. I'm just gonna listen to his bowels, all 4 quadrants, and he does have active bowel sounds throughout his, throughout 4 quadrants. Good. And then I'm gonna percuss. Good. And I'm gonna do soft palpation. You let me know if there's any pain. And then I'm gonna do deep palpation. Is there any pain?
No.
And then while he's lying, I'm gonna check on his femoral pulses, and I'm gonna make sure that it's correlating to his radial pulses, which it is, bilaterally, and it is. And since he's lying, I'm just gonna do for full range of motion to his thigh. How's that? Are you having pain?
No.
We're gonna do the same way here. We're gonna do full range of motion. Any pain?
No.
Good. I'm gonna have you sit up, okay? And then I wanna check on his upper extremity, check on the pulses. The brachial pulses are present, radial pulses are present. Check on the capillary refill, make sure it's less than 2 seconds bilaterally. And that's present. And then check on his femoral pulses and his lower extremity pulses. Any numbness or tingling?
No.
And make sure the capillary refill is less than 2 seconds, which is normal. And then check on your strength. Push down against my hand. Good. Push against. Good. Squeeze my hand. Good. Same thing with your leg. Push against my hand. Push against it. Good. And push against it. Good. So full range of motion is intact. He has really good strength and good grip. All right. I'm gonna have you stand up. Stand up for me. So we're gonna check for scoliosis. So I'm gonna have you put your hand in like you're diving down. So touch your knees and dive down. Good. Good. So I want to check, and his back is straight. There's no curvature. There's no sign of scoliosis. Good. Stand up. And then turn over. I want to take a listen to his heart rate when he's standing up to make sure there's no murmur while he's standing. Just pretty normal. And there's S1, S2, no murmur. I'm gonna have you squat down. Can you squat for me? Squat all the way down like you're bearing down. Good. And when he's squatting, I want to listen for any murmur too when they're bearing down to make sure to rule any holcomb, which I don't hear any murmur, which is really good. S1 is S2 very strong. And then we're gonna have you do the squat walk. So I'm gonna have you squat down, walk 2 step up and 2 step down. Squat down, walk 2 step up. Good. And then go back down. Backward. Good. Okay. And then I'm gonna have you hop on one knee. One leg. Hop. Good. Other side. Good. Everything looks good. And then this is when we'll do the tanner, and I'm gonna, check on to see his tanner score, to see if he has any armpit hair, any pubic hair at this time, and also we want to check for any hernia. So I'm gonna palpate on his groin, have him turn that the same way, and have him cough. Good. And then we'll do the opposite side to check for hernia on the other side too. So I'll have him turn the other side and also cough. And then I don't feel any hernia. So also last thing I want to check on his deep tendon reflexes. Sit down. So the most common ones are the brachial one. So check on the reflexes here and patellar reflex. Good. Good. All right, everything's checked out really good. Lastly, I want to talk about some anticipatory guidances to help him and I'll have parents come in. We'll talk about some important anticipatory guidances such as Safety, like, he's starting to drive, so make sure that, he's wearing his seatbelt all times. Safety with friends, check on relationship with patient or with patient and parent and patient relationship. I also want to talk about dietary. Make sure that he's getting sufficient water intake, at least 6 to 8 ounces a day. Also, if make sure you drink your milk. If you are unable to tolerate milk, get lactose free, but also take in calcium such as cheese or yogurt intake. And with our yearly valuation, we also want to check his hearing with audiology from 4,000 to 8,000 hertz, and check on his vision with a Snellen chart. You have any other questions for me?
No.
All right. Thank you so much for being my patient today. Thank you.